Hi everyone, I still remain the humble health administrator you are hearing about. My name is Chinaza Jennifer. I'm from Ubenajima, Enuzu local government area in Soka, Enugu State to be precise. Okay, today I'm going to lecture you people on the topic sexually transmitted diseases. I know that most of you might have come across this topic, but today I'm going to elucidate it in the way you comprehend it more. Now, what are sexually transmitted diseases? Those diseases that are what's gotten. They are those diseases that are gotten from what sexual activities, from sexual intercourse. Those diseases, those sickness, those infections, those illness that are gotten from what sexual intercourse or sexual activities. That is what we call what sexually transmitted diseases. They can be transferable, they can be transmittable from one person to another. That is why we are calling it what sexually transmitted diseases. Those diseases gotten from what sexual activities, sexual intercourse. Okay, as I was saying, I'm talking about sexually transmitted diseases. Those diseases that can be transferable, that can be transmittable through sexual activities or sexual intercourse. You cannot get it from any other place except what? Through sexual intercourse. Now, what are the examples of these diseases? We have the genital herpes, we have the gonorrhea, we have syphilis, we have the human immune virus / was acquired immune deficiency syndrome. We have the human papilloma virus. We have hepatitis B and C. We have the trichomoniasis. These diseases are what sexually transmitted diseases. That is why whenever you observe any boils or any regular itching on your genital organ, make sure you call the attention of what doctors for them to administer drugs for you. If you leave it like that, it will damage your organs. It will damage the sexual organs. So call or draw the attention of doctor for a better treatment. Okay, let's talk about this disease called candidiasis. You know, it can be a sexually transmitted disease, but it is a yeast. It is a fungal disease, an infection that is caused by a microscopic organism called what? Candida albicans. It is a fungus what disease. You know, many people suffer this candidiasis, especially women. They suffer it most especially when this organism is what numerous in the vaginal flora or in the urinary tract or even in the oral cavity. That is why this disease you can contact it through kissing. You can contact it through kissing. So this disease is a very dangerous disease that's supposed to be taken care of, that's supposed to be treated immediately when you observe it or when you started having the feeling that you have this disease. Make sure you will treat it immediately. Okay, as I was saying, I'm talking about candidiasis, a fungal infection, a yeast infection. You know, this disease normally affects the female sex. Now, what are those symptoms, those signs that you notice in your body, especially the genital organs, that will tell you truly that you have this disease called candidiasis? We have one, the burning sensation. We have painful urination. We have reddish vulva. We have dyspareunia, that is painful sexual intercourse. We have regular fever. We have the oral thrush. We have many of them. We even have whitish vaginal discharge. You'll be having an offensive odor from the coming out from the vagina. These are the symptoms that differentiate this disease from other diseases. All right, as I was saying, I'm talking about candidiasis. Yes, I'm talking about candidiasis. And you know, this candidiasis is common in immunosuppressed individuals. It's common in immunosuppressed individuals. Now, what are the drugs you need to drink if you are having this disease called candidiasis? You need to drink antifungal drugs because it is a fungus that causes this disease called candidiasis. You need to drink antifungal drugs. And what are the antifungal drugs you need to drink? You need to drink fluconazole, even clotrimazole. Fluconazole at least 800 milligram or 400 milligram, at least 2 weeks, either intravenously or orally. You drink it, you take it. It will help to treat this disease called candidiasis. Thank you. I still remain your humble health administrator, Chinaza Jennifer. Thank you for listening to my lectures. See you in my next class. I love you.